Health challenges for the community, I would say first and foremost, we are struggling with a lot of misuse of prescription medications. We're struggling with a lot of misuse of pain medicines. As anybody who's read the newspaper and watched the news, we're dealing with a opioid drug crisis in the country, and that affects a lot of my patients, those receiving pain medications, those of family members receiving pain medications. I have a lot of senior citizens that are serving as the primary adult for their grandchildren because their parents are struggling with drug addiction or the consequences of it. So I think that's a major unique health challenge that we have in America right now that is affecting us in Bardstown. Another thing I think we struggle a lot with is resources for behavioral health care. I have a lot of patients that need behavioral health interventions, and there can be a long time in a waiting line queue to get those services. And as primary care providers, we can oftentimes serve as the fail-safe mechanism during those gaps in their behavioral health care to make sure they don't fall through the cracks. Third challenge I see, which is not unique to Bardstown, but we see everywhere, is the cost of health care, the cost of medications, the cost of doctor's visits, the cost of procedures. And I can't operate in a vacuum from taking that into account when I care for a patient. And that sometimes we'll oftentimes discuss that, which is the impact of the finances and my treatment recommendations on their finances, and making sure that we understand how that works and what I can do to help and what they can do to help. Tobacco is another big health issue in this area. I can say that Kentuckians smoke in excess to what I've seen in other states, and dealing with the health complications of that, as well as helping them to stop smoking, is definitely a challenge.